the supplies. So for that reason, we will find this here instrument, and that we have to give a code. Since the sedation is also provided, and then whatever the examination is also done, the scope, how much he has entered into the body, and see this whole the description of a procedure, what he exactly has done, how we process the things, and after that he has a plan is also given, what he have to do and what he is supposed to when he should come to the follow. And now this is the code 45378. This is the procedure code that we have to check into CPT code book, and this is the ICD-10-CM code, that is the diagnosis coding. It is for this vein, why this bleeding is has done. So this code they have given here. It may be kind of, I didn't check this code, but it can be for the image, it can be for the diverticulosis or something like that. So this is a basic thing we have to code here. And as per this ICDs and CPTs, the payment will be provided to the physician or the hospital. So this is on overall introduction of CPC. So today's section, we will going to discuss for the first introductory part of the coding. It is for ICD-10-CM. So I have divided this lecture into two parts, first and second. In the first part, we will going to see what is ICD-10 and what are there, because you know that to code a medical record, what is exactly our job is, we need to identify the diagnosis, and as per the diagnosis, the treatment is being provided. Just like we have seen the example, the patient was having the rectal pain, rectal bleeding, and abdominal pain. So this was the diagnosis. This was a thing, and to evaluate that, the procedure has been done. So to code the diagnosis, we have a bunch of set of book, the code sets. This is called as ICD-10-CM. This is a complete set of code book, which is including every disease in that. So just today's goal will be, we're going to focus on ICD-10-CM, the structure of ICD-10-CM codes, the demonstration how to look up into the ICD book, and how to capture the code from medical record. Then after, if we get time, we can go with the scenarios. We'll focus on few scenarios, how to find the code in ICD book, and then the ICD-10 techniques, how easily we can find the code in very short term. So let's moving further. Guys, I'm audible to you, correct? Yes, no?
Yes, please
Okay.
confirm.
Yes, yes.
Okay, so is anybody having any question till now? Just please ask me, because once you start with ICD, so there should not be any backlog or anything, that concept which is not cleared. Okay, so you all guys know why we are studying ICD-10 now, correct? Right, guys? Why we are learning ICD-10? Because we have to code the medical record, and to code the medical record, we need to code the diagnosis, we need to code the procedures, and we need to code the supplies. To code the diagnosis part, we have to learn ICD-10-CM. From that only we can code the diagnosis. For procedures, that is the second part of this curricular. It is CPT coding. That will we see after 2 to 3 weeks once we're done with this. Okay, so let's move on and see how it is and how hot it is. So see guys, ICD-10-CM, it is a complete book. It is a set of codes as per the AMS guidelines. The ICD-10s are packed with official guidelines and conventions, medical code edits, intuitives, color code symbols, alerts, full color illustrations, and more, all present in user-friendly page designs. AAPC's ICD-10 code books are approved by coding trainers and can be used during the certification exam. So why we have to learn this ICD part is very important. That so to code a particular diagnosis, we cannot code just likely. To code a particular diagnosis, there are set of guidelines which is provided by AMS, which is the authority who's monitoring everything. which is a delegated authority. He is taking care of all of this, you know, government regulations, how the code should will be. They are this a huge body who is monitoring on this big CMS. Okay, that is a very good, you can say, revenue cycle management procedure. So they are keep watching on these things, and they are set the guidelines every year, and every year the ICD-10. Now, why we will say, you will come to know that why ICD-10. So ICD-10 is a very simple thing, is that International Classification of Disease, that is a ICD. And why it is 10? Because it's a 10 version. Before 2024, it was ICD 9, because it was a ninth version. And why it is 10th version? Because they have updated lots of codes back, because you know that few years back there was no COVID, correct? There was no other diseases. So the COVID was introduced. If we keep using those previous books, there won't be any code for the COVID. So in these new books, they have introduced the COVID codes, and then it is updated. And if every year it is getting updated, so every year we have, they sets a new guideline, and that we have to keep yourselves updated. So don't worry that once you come into the flow you will get knowledge of it. Okay, so that's why it is saying that the ICD-10 are packed with official guidelines and conventions. There are certain rules, there are certain regulations that we need to follow, because you can't go just go and pick any code with like this and that. No, to pick any code there are certain rules, and that we need to follow. Again, the medical code edits, it's a kind of a thing that if there are two conditions, right? Just take an example. I'll give you a sore throat. You know the sore throat, pharyngitis. Anybody, all of the medical students, right? Pharmacy students, correct? Yes, guys.
Yes, sir.
Okay,
Yes,
okay.
sir.
Just yeah, okay, fine. Thank you. So why the medical edits is there? Because if you go to the doctor, if you're having some cough or fever, so if you see the prescription, he might some write some strep throat or pharyngitis. In that case, we when we have to quote this report, the final diagnosis will be the sore throat or pharyngitis. In that case, when we need to quote the final diagnosis, we can't go and quote cough, because the cough is a symptom. Okay, and the pharyngitis is a disease which is causing the symptoms, right? So Medicare code edits is showing that there are certain things. If there is a final diagnosis, so you can't code the symptoms. So these are the some edits are there. Just I give you one example, because there are lots of edits are there, because there are lots of chronic conditions also there. You know chronic conditions, guys? Acute conditions, chronic conditions. You know, right? Yes. Diabetes is it chronic or acute? Hypertension, chronic or acute? Guys, no answers. Okay. Chronic conditions who can last long, that condition is called the chronic conditions. And acute conditions which can be resolved in month of 1 or 2 months, it is getting resolved. It is called the acute conditions. So to code the chronic conditions, we have code edits. To code acute conditions, we have the code edits. So this how it's everything is included in this ICD-10 book. And again, why it is color and call combinations, everything is there, because you think, guys, it's not just a simple book. It covers all each and every diagnosis that human body possesses. And you know what, if we need to really go into it, we have to make some arrangements, we have to do some segregations. Okay, so that's for the reason they have used very good color and combinations. And it's very important to for our usually persons who are the coder, who can keep in mind, and through the symbols and colors. It's just like an when we travel to the any one destination to another destination, there are some signages. The colors and combinations are for that only. They will always will be there, and they will gives us a signal what we have to go. Just like where do we have to take a right, where do we have to take a left. This is a color combination is for that reason. and it is very user friendly. That we're going to discuss how it is very user friendly. Just give me one example. Just tell me, guys. Have you ever seen any medical directory or dictionary? Have you ever gone through that medical dictionary or any other language dictionary? Hope you know about what is the dictionary. Telephone dictionary, guys. You there, guys? No answers.
Everyone will respond.
Let me check whether really I am there in the meeting or not. Okay. So you know that how many of you know that there was few years back, I don't know when we were very at younger age. That time we used to use phone directory. You know, there was
Yes.
very
Yes.
yeah phone directory. Then how you
Yes, sir.
supposed to find out any person's name? You know, right?
Alphabet. Alphabetical.
Alphabetic,
Alphabetical
yes,
order.
absolutely, absolutely. Alphabetical order. If their name is something like that, you can say Shinde. Then we will search with S. Then we go for H. Then we go for I. Correct. And after that Shinde, then we will be finding lots of peoples of what the naming of Shinde. But when more our other thing is that after the surname, we have to go with the father's name or that person's name. Correct. The same thing is here in to find the ICD codes, the diagnosis code. So that's why it is given here that it's a very user friendly page design. So don't worry that code is very easy, and every time it will suggest to you. It will every time it will guide you. You need not to remember anything. Just follow the guideline. Just see the color coding. Just see the instructions. And this is the very common thing for the ICD-10 book and also for ICD CPC and the HCPC book also. You nothing need to worry. Just follow whatever the code is going to help you. Okay, just follow that instruction, nothing else. Okay, can I move on? So this is the history, very little bit history. Apart from that, just don't go with this. What is HO and everything? Okay, these are the higher bodies are there who was keep monitoring on this thing. They have to keep regular monitor themselves. They have to edit some codes. They have to delete some codes because what is happening is few diseases are not there in the human body, so they have to they don't want to keep that thing in the scope in code set, so they are removing it. There are new things are there, they have to introduce in it. Then there are varieties of things are there, just like a coronavirus mutation 1, mutation 2, mutation 3. So they have to introduce in that. The first and the final thing in this slide is the fifth point, that HHS mandate all the covered entities under HIPAA employ ICD-10 code CM2. This is the very important part. Why it is important part? Because as we are coding for the US healthcare, the HHS is the authority has forced all the entities means any physician in the US, any facility in the US, they have to use this ICD-10 code sets. After that, if he tries to use anything, the medical bill or insurance will not accept. Hence, it is very important to be a medical coder. We have to learn this. Even physician has to learn this. Any facility has to learn this. And the same thing is here also. If you know this very well, don't worry. You will get it easy things while coding. So this is a very important part, that we are not doing something any niche kind of thing. It is overall accepted thing. You go anywhere, the ICD-10 CM codes will be there. The same guideline will be there. The same instruction will everybody will follow. It is not like that India will not follow that. US will not follow that. No, no, it's not like that. The general things are there, which is set by these high authorities. They that whatever they have said, that everybody has to implement that, and that is very good thing. That is why all the guidelines are overall in general. If you go in anywhere, it will be the same. So what exactly the ICD-10 manual contains? So see that this ICD-10 manual CM for the clinical management. This is a clinical management. This is for the physician and facility purpose. So it is includes estimated at least, this is a rough figure, that's 72,000 codes. This is a rough figure I'm telling, but now it is more than that. It is almost crossing 80 to 90,000 codes. So this book contains almost 80 to 90,000 codes in it. Okay, which is affecting the human body and which is being as a to build that we have to use that. And after that, the guidelines are divided into 4 sections and 1 appendix. So this is the structure of that code set. What exactly the ICD-10 CM book is consisting having. It is having 80 to 90,000 code sets in that. All the diagnosis coding including all our general diagnosis which are affecting our human bodies like pneumonia, diabetes, hypertension, hyperlipidemia, seizure, everything it will come to. After that, not limited to this, it will also include the injuries also, whether it will be the fracture, it will be the bone fractures, any kind of head injuries, comas, everything. It that also included into this codes set. Okay, and this the things is divided into 4 sections. That is, section 1 has 3 primary set of guidelines, that is conventions, general and specific coding guidelines that we'll see in coming lectures. Then section 2, it is a principal diagnosis selection that we don't need to take part. It is because it is a something different code. This code sets, these sections are used for CCS. It is a very higher level of coding, but for the CPC, we have to focus on the section 1 and section 4, that is the outpatient guidelines. Section 3, for section 1, which is having convention, general, specific coding, these are very general that we have to follow. And section 4, that is the outpatient guidelines, that is mostly used for the physician and for the facilities that we want to focus. Other rest of the things are there, but we do not to take care. Am I clear, guys? So this was about the ICD-10 book manual. Now just go with this.
Not audible, ma'am.
Sorry, is can you please repeat? Hello, someone said something. No, okay, fine then. So this is how this structure of ICD-10 CM. It is having these code sets and all the sections, which is having appendix 1 also, section 1, 4, 5, 6. It is also, and this is the table of content. This I tried to take a snap, but I will give you a more specific. Here is the book. This is the online copy. You can see here ICD-10 diagnosis code for providers and facility. Providers are the general physicians who takes daily appointments, and facilities, these are the hospitals. And now see this table of content. All this book contains this all the topics. If you see here, is it the screen is visible, right? It's zoomed once. Okay. So see the table of content. The first part will be the symbols and convention that we see. It will keep you instructing how to use this code, why to use this code. Then the ICD index for diseases, injuries, table of neoplasm. You know neoplasm? You know the term neoplasm?
No.
Do you know cancer? Cancer?
Yes, sir.
Okay. This cancer is called as a neoplasm. Cancer is a condition and neoplasm is a cell structure. Okay, so we have a table for neoplasm because cancer is either a malignant, benign, in situ. You know the malignant cancer, benign cancer, in situ, malignant cancer which can be spread from one side to another. Benign cannot spread in situ, it's just a lesion. So when the person is having any kind of a cancer like liver, brain, so all the codes will you find in this neoplasm table that you have to learn. Again, the drugs and chemicals, drug and chemicals. Why it is for? Sometimes that the patient which has been prescribed for antibiotics, okay, but the antibiotic does not suits him, so it start to develop some allergies, correct? Any kind of swelling, any kind of vomiting, or any kind of rashes. So that time when he comes to the hospital, that that condition is caused due to some drug or some chemical. So that drug and that chemical we have here table. We have to search here also. There are some other things also, not just an allergy. If the person is doing for the suicide, for suicidal, he uses some drugs. So that drugs also here in the table. Lots of things are there. If they are having some allergies with some chemicals, just like an detergents, so that the allergy is due to the detergent. That for that detergent we also have a code. So this is how it is. For index, disease and injury, we have index for disease and injury. We have table for neoplasm. We have table for drug and chemicals, and we have the index for the external cause of injury. Now, what is this external cause of injury? See, like in index, we have seen the injuries, right? But the external cause are the thing. What is the main exact reason of an injury? See, the patient has fall from the scooter or some bike, so he had some head injury. So he fall from the bike. That is the cause of injury, and that all every cause you will be find, every external cause you will find in this index. Okay, this is complete set of it, and then the tabular list of disease and index. Now you will come to know that there are index and the tables, right? Index, you will just guide you a simple introduction, but the tabular list, it will give you a brief introduction. That's why the chapter 1, you can see the certain infection or parasitic disease. Also, see, they have given a A00 to B99. So from A to B99, in that all code sets, you will find all the certain infections and parasites names and their disease. Means if person is having some sepsis, okay, sepsis is caused due to some organism, correct. So what kind of organism has caused the disease, and the other parasites which are causing the disease, you will find their every code in this code set. That's why the first chapter will be the certain infection and parasitic disease. Second chapter will be the neoplasm that we said, like we said, it is a table that we're going to see. And disease of blood and blood forming organs and disorders. So this is what the thing is. Whatever the disease are caused by the blood and blood forming organ and disorders, including the immune mechanism, you will find it here. Means all type of anemias, all type of blood related conditions you will find here. The chapter 4 will be in endocrine and nutritional and metabolic disease. Means that this is the thing when just like an like diabetes. It is why it is happening diabetes, because the insulin, correct, right? The pancreas, correct.
Yes, sir.
Could you able to lead me? See, insulin, diabetes, insulin is not getting secreted. Why insulin is not getting secreted? Because it's a pancreas. And what is the pancreas? It's an endocrine gland, right? So that's you will find the all related codes in this. When the code is related to endocrine and nutritional and metabolic disorders, this is caused by the metabolic disorders. If is if it's having some disease due to hyperkalemia, hypokalemia, okay, you will all find this in these courses. Then mental, behavioral, neurological disorder. If patient is mentally ill, like he's having some dementia or like something, any neurological condition is not behaving well. So all the mental and behavioral and environmental like disorders you will find in this chapter 5. Neurological symptoms, any neurological condition in the body, you will find all the codes in this chapter 7. Disease of eye and adenexa, eyes, right? We some people are having eye pain, everything, every related to eyes, you will find here. There is conjunctivitis, okay, glaucoma, everything, cataract. This is related to eye, right? So eye and adexa. So eye related diagnosis you will find in this chapter 7. The disease of ear and mastoid process. So ear, like ear, we have some cerements, ear infections, like this all you will find in chapter 8. So this is all about, see, this is all about then the circulatory system. You know that circulatory system, correct, guys? Circulatory system, heart, correct? So heart related conditions you will find here, just like you know that heart attack, CHF, correct? So heart related conditions, circulatory system like conditions you find in here. The respiratory kind of conditions like asthma and everything you will find in chapter 10. Digestive system just related to our stomach, whatever there are, you will find in this. So this thing is completely based on our body systems. How many body systems are there in human body?
11.
11 or 12. So for doing this, we need to thorough with our body system. Even I was planning to start a session with the body systems, but it will be again time consuming. I left it to you. So before going proceeding further, we need to clear all your concept with your all the body systems, because it's everything depends on that. As much knowledge you have about the anatomy and physiology, that will be help you to understand the diagnosis and the structure, and you will come to know easily with the codes and the procedure. If you don't know what is the digestive system, what are their parts, how it is the flows is going, what is colon, what is the cecum, and what is the large intestine, what is the small intestine. So it is very difficult for you to grasp the CPT and the procedure with. So I request you guys to, if you want to really make these things easy, so first just give your time for the reviewing the systems of all 12 or 11, 12, whatever the body systems are there, need to go through it. Now see the 12 are the skin, whatever the skin related conditions, all the diagnosis you will find here. Okay, so there are genitourinary system, musculoskeletal system, and see pregnancy related things also it is covering. See pregnancy related conditions, when the patient is pregnant, so what kind of complications is having, whether when at the very drastic complication is that when the patient is pregnant, she's suddenly develops high sugar. So that is how we will code that in pregnancy condition, that will know the in pregnancy the hypertension is also there, and some other condition complications are there also there, blood complications also there. So this everything, all the complications are and diseases are covered in O00 to O9 A series. In certain condition of perineal period, so this is a very interesting thing. Prenatal period. Prenatal period means a very newborn. When the patient is newborn, right? For the newborn, these code sets are for 0 to 28 days. When the newborn is only for 0 to 28 days, then we have to go with this code series P00 to P98, P96. Then malformation, deformation, and chromosomal abnormalities, just like some hemophilia is there, something, some some chronological disorders are there. This all code series you will find in this Q2, Q99. Then signs and symptoms, just like fever, cough, these are the signs and symptoms. So you can search this code in R2, R99. Now here the injuries, poisons, and external core morbidity codes. These are the very simple what will come across as. So have you come to know what exactly the code sets are and what this exactly contains, this IC10 book? Hope you understand that, correct? Yes, guys. right?
Yes, sir.
If you have anything, please stop me then and there, okay? Because today is just an introductory session. Correct, guys? Anybody has having doubt this at this point?
No.
Hope I am clear with it. So can we move ahead?
Yes.
Okay, thank you. So next slides will be the key ICD-10 CM layouts and key definitions of the index. So we have seen all this. There are some tabular things, there are some chapters, but how to check, how to search the code in this whole code sets? So this is a very big challenge. So to avoid this kind of trouble or this kind of complications, we have made a very easiest thing that to find any certain code with or not just a certain code, a specific code which is very accurate. To find that, we have step one, and step one is that first we need to check the index. Correct? When you look up to main term or diagnosis, this is always your first point of contact when look up a diagnosis. Okay, just like we had a very good example of a telephone dictionary. If I need to search a name for Shinde, so what I will come across with that name, I will search a main main term, that is the surname, that is a Shinde. The same thing is here. When you to find many diagnosis, we need to see the main term of that diagnosis. Once you know that this is a main term, just go to index, find that, and once you go approach to that thing, it will lead you to go to tabular index. So keep in mind always is that there are very major and very standard states to follow the ICD-CM diagnosis. To find diagnosis, ICD-TM diagnosis, your first step will be go with the index. And once you get the index, follow the index. That index will lead you to step two. Okay, that first step will lead you to step two. Hence, index has a two parts. First index is, as we like say, the disease and injuries. So whenever you have some disease, we have to learn the main term of it. And if there is an injury, what kind of injuries that, see, injuries are many types. Like there will be the laceration, there will be the fracture, there will be the contusion, there will be the sprain, there will be the strain. So we have to first identify the main term. Now, what with the main term? Like if the patient is having a rib fracture, okay, the rib is not the main term. The fracture is the main term. If I have to, because it's a diagnosis. Rib is what? It's a part. Rib it is a part. Rib is it a part? It is a bone. So it is not a main term. To find the diagnosis, we need to know what is the main term. The main term is for the rib fracture is a fracture. So what I will do, I will go into the index, I will search the things with F, then R, and then once I relocate with the fracture, then I will see the location where the site, which site is been fractured, whether it be the humerus, whether it be the radius, whether it be the ulna, whether it is the femur, whether it is skull, everything. So main term will be the fracture. So is this index first is all dealing with that. Same like neoplasm also. When you find a certain neoplasm, always look for the index first. When there are, if the diagnosis is for skin cancer, diagnosis for pelvic cancer, diagnosis for skin cancer, diagnosis for brain cancer. So with going with the location or organs, you will find. If you go to neoplasm term, then that will lead you to get the cancer of a brain. You have to do, and you have to go this way, that way. Again, regular drugs also the same thing. When you will find the drugs and chemical related to illness or injury, just we need to go with the main term. And again, the part B will be the index to the external cause code. The same here also. The external cause codes are not disease and illness or injuries. Okay, these are just the status code, or they will cause. The name itself says the cause of a reason, the cause of an injury, the cause of particular XYZ things. This code decides what's caused the disorder, illness, injury, how, when, where it is has happened. Okay. If the patient is fall from the scooter, so where was the scooter? Whether it was in a garage, whether it was on the road, whether it was in the parking, then which parking, whether it was a hospital parking, whether it will be, why this, you will see why there is a need of that. No, that's why I say they has given the authorities which have said all the things, because physician should not do any fraudulent activity. This is how they have minutely developed in such a way. When the patient will come with a fall only, but where he fall, they need to evaluate. If they are saying that अभी हम हमारे यहाँ पे जाते हैं बोलेंगे भाई मैं गिर गया, तो डॉक्टर पूछता नहीं कहाँ पे गिर गया, तो वहाँ पे ये सब दिखाई पड़ता है, वहाँ पे सब पूछना लिखना पड़ता है कि ये पेशेंट हॉस्पिटल में गिरा है, वो यहाँ पे गिरा है, वो वहाँ पे गिरा है। अगर ये कंडीशन नहीं सेटिस्फाई हो तो वो कोर्ट डिनाई कर देते हैं, उसको फिजिशियन को बिल पे नहीं होता। So that's why it is very important for us to go every small part of this ICD-10 book. What my point, guys? Yes,
Yes, sir.
no? Okay. I hope others are also listening. Is this feeling sleepy? Hope it is a Sunday only, guys. Maybe people are in the mood. Hope it is not. Correct? Fine. I'll move ahead. So the first step would be the index. Now look at this book. What you can find here. First, we have seen the index list, and now the second part is that the tabular list. You can see the difference here. At the right side, you will find in this bracket rectangular blue shade the simple one book only. One part is having all these black edges, and the right side is having other colorful things. Correct? Maybe yellow, red, blue, green, something like that. So this ICD-10 book is divided into these three parts. First is index, this is the tabular, and the last one is appendix. Okay, so what is our first rule to check any diagnosis? We need to go with the index, correct? So from 1 to part this, it is the index. Okay, it is in black. Hope you understand, guys. Hello, let me check whether all are there or not. Darshat, you are getting my point? Jitendra, Prithvi,
Yes, sir.
any doubt till here? This is the introductory session. Okay, we need to know the book completely. That's why I'm taking this much of time. All right, and this is a very general thing. If you want to do a very career in this coding field, you have to use two of it. This is a very thumb of rule for that. Rekha, are you getting? I don't know this boy was B. Are you getting? Shivani, Saili.
Yes, sir.
Hope no
Yes,
doubts.
sir.
Hope you are clear. Why am I asking you? Because wherever you go into coding field, this is a very basic thing. Once you grasp that thing, it is very easy for you to find the code. Leave it other part. There are lots of softwares are there. You just need to enter the diagnosis and everything. But as the point for the cracking the exam, you have to use this thing only. You have to go with the books, and there is other options, or you are opt for the online softwares while the CPC examination. But if you cannot able to use that online software, but that time we have to come with the books only. That's why you have to make very handy yourself with using of these all the books. That's why I'm tracing you. Just take it that thing. How to find a code in such a big code set? First, we need to go with the index. The index is here from usually see that black and white things. This is the index, and after that, this is tabular. Okay, whatever you will find in index, the tabular will give you in whole description. All right. Now see here. The section 1 conventional general coding guidelines. We'll start with that. Right. Anyhow, we have started late, so we'll take 15 minutes extra today. Okay. So how to look up a code in ICD TMCL manual? There are three basic steps that we have learned. The first step it will be look up the main term in the alphabetic index, just like I given a example. If the name is Shinde, Manoj, Bharat, so the main term will be the just like surname. So that's how it is. We have to find the main alphabet index, then verify the code. There will be the many shindes like in the dictionary, but we have to come with a more specific code. Okay, what is the specificity that will be verified into tabular list? And third point that I have not mentioned you in that series, that two slides, it is a review of guidelines. Okay, the review of guidelines, it's a very important thing that we have to keep in mind, because once you come across index and tabular list, so there are certain guidelines to use the particular code, like diabetes, when to use, how to use, for hypertension, where to use, how to use. So using these guidelines, we can only go with the exact code. Just like I will give an example. If the patient is having hypertension and the patient is having a CKD. CKD, you know the CKD? What is it? CKD?
No.
No? Okay. The CKD is chronic kidney disease, right? Just like you said that the patient is having kidney failures, correct? His kidneys are not working, so the doctor is saying you have to go for the dialysis, correct? So how you will code that? If the patient is having hypertension and the patient is having kidney disease, so there are certain guidelines. Okay, so that guideline you have to follow. That when the patient is having two of these conditions, these are completely related with each other. So we can code as a combination code, that hypertension with CKD. So we can code hypertension separately and CKD separately. So these are the review guidelines. Using these guidelines, we have to give the diagnosis code. Correct? Getting my point, guys? Hope I am clear with that. So how to look up in the code? The first step will be the alphabetic index. Then second, you need to approach to the tabular list. And after reaching to the tabular list, you have to go with the guidelines which is provided by the CMS. That we'll see also. Hope I clear, guys. Anybody having any doubt here? Don't worry about the review guidelines and all those things. These are very simple guidelines. There are not much big changes are there. They are very easy. Just we have to keep in mind that why and how to use that particular code and different scenarios. Okay, can you move ahead? Everybody hope get the answer how to capture the code from the this all code sets. Getting my point, guys? Okay, fine.
So,
I hope nobody is having any question. Very surprising. Ask very small doubt. Okay, the most you will ask the doubt, it will help you as well as other also to understand the things. I will try to give my best also, because nobody is perfect. All right.
So guideline is mentioned in the same ICD book or
Yes. See, I will show you the ICD book. Can you see my page? Can you see screen, correct? So this is a online book. Okay, this is a e-book. All right. This is a cover, and this is something published in notes and everything. This is a table of content. See, ICD-10 CM official guidelines for coding and reporting for the year 2024, October 122 to September 30, 24. It is there in the book itself. That's why I told you need not to worry. You just need to be very sure about how to handle the book. Even in exam, you know the how to handle the book. Even a very situation, if you miss something guideline, you can come to the book and just review the particular guideline on that disease. You can give a proper code. What's my point? But the thing is, you should know how to use this book. That's why I'm forcing you. If you still having any doubt, please clear it here and here only. As much you clear yourself, it will help you. See, these are the official guidelines. How to use alphabetic symbol format structure. Everything is here. Even this is if it is diabetes, endocrine, nutrition. So how to use the diabetes code, when to use the diabetes code. So this is the book. Just see the pages here. 1410. This is a code. These are the pages. And it's having everything. Hello?
1400 पेज पूरा पढ़ना पड़ेगा।
नहीं, इतना पढ़ने की जरूरत नहीं है। इतना पढ़ने की क्यों जरूरत है? हमको इसमें से क्या करना है? आप जैसे देखो ना, एक वेरी सिंपल थिंग है। हमको अगर मेरे को आपका नाम क्या है?
पृथ्वी।
हाँ, ओके। तो आपको अगर मुझे आपके नाम का अगर मोबाइल नंबर या टेलीफोन नंबर ढूंढना है, तो मैं बस उसको ही ढूंढूंगा। मैं दूसरे नंबर का कोई मैं साइली का नहीं ढूंढूंगा, मैं सागर का नहीं ढूंढूंगा। मुझे जब का आपका ही नाम चाहिए तो मैं आपका ही ढूंढूंगा ना। जस्ट लाइक द सेम, अगर मुझे डायबिटीज का कोड चाहिए तो मैं डायबिटीज का ही कोड ढूंढूंगा। दैट्स इट, वेरी सिंपल। व्हाट माय पॉइंट? ये कुछ
Yes.
पढ़ने की जरूरत नहीं है। ठीक है, देखो, आई विल गिव यू वेरी वेरी एग्जांपल। हम जब लाइसेंस लेने जाते हैं, ओके, 2 व्हीलर का लाइसेंस होगा, 4 व्हीलर का लाइसेंस होगा, ठीक है। तो हमको वो एरोज दिखाई देते हैं, राइट? अगर राइट साइड में एरो है तो राइट को टर्न लेना है, लेफ्ट साइड को एरो है तो लेफ्ट साइड को टर्न लेना है, ठीक है। तो हम जब ड्राइव कर देंगे तो हमको क्यों वो एजुकेशन लेना पड़ता है कि यार अगर ऐसा साइन हो तो मुझे लेफ्ट लेना है, ऐसा साइन हो तो राइट लेना है। बस इंट्रोडक्टरी सेशन में हम यही करेंगे कि जब मैं कोड करने जाऊंगा तो मुझे जब ये साइंस दिखेंगे तो वो साइंस मुझे क्यों यूज करना है, दैट्स इट। बाकी उसको वहां पे ही छोड़ देने का है। when you come very used to of it, then you don't need to all the signages also. Getting my point? इतना कुछ पढ़ने की जरूरत नहीं है। These are the just guidelines for us. These are just the navigators. Okay? समझ रहे हो आप?
Yes.
Okay? क्योंकि ये इतना revenue cycle management is a very big thing. There are lots of difficulties. There are lots of challenges also to give a certain code. Because just take an example ना, डायबिटीज एक ही डायबिटीज नहीं है यार। डायबिटीज के कितने मैनिफेस्टेशन है, डायबिटीज के कितने कॉम्प्लिकेशन है। इसको डायबिटिक रेटिनोपैथी है, डायबिटिक नेफ्रोपैथी है, डायबिटिक कितने प्रॉब्लम्स है, हाइपरलिपिडीम है, कितने हाइपोग्लाइसेमिया है। सो उसको कैसे आप कोड करोगे? इट विल बी कम टू यू इन वेरी कंफ्यूजन, राइट? टू अवॉइड दिस कंफ्यूजन्स दे हैव सेट ऑल दिस रूल्स। व्हाट माय पॉइंट? सो और इस बुक में सब वहां पे दिखाई दिया है, चैप्टर वाइज दिखाई दिया है, ठीक है। So this is how the book is, correct? So we'll move ahead. और किसी को कुछ doubts है? Thank you guys for asking me these all 2 questions. Is there any more? Please, you are welcome. Correct? For moving ahead, because this was very introductory part and यहाँ तक मैंने आपको बुक कैसे यूज करना है वो बताया है, बुक में क्या है वो भी बताया है। नेक्स्ट स्लाइड में आपको बुक में कोड कैसे अरेंज किए हैं वो मैं बताऊंगा। इसलिए बुक के रिलेटेड अभी इतना जो सेक्शंस है उसमें किसी को और कोई डाउट हो प्लीज बताओ। तो हम will move ahead. Okay, fine then. I'll go ahead and we'll discuss the section. See, the section 1 conventions, general coding guidelines, and chapter specific coding guidelines. Like we have seen in this slide, ICD-10 manual, which contains of section 1, 3 primary sites of guidelines, that is conventions, general and specific coding guidelines. So we'll start with the conventions. कि यहाँ पे जो इतने सारे कोड्स है 80,000 90,000, ओके, वो एग्जैक्टली कैसे उन लोग ने अरेंज किए. ऑलराइट, सो दिस इज द थिंग. A convention of ICD-10 the convention for ICD-10 are general rules for use of classification independent of the guidelines. The convention is incorporated within the alphabetic index and tabular list for ICD-10 instructions as noted. So ये conventions क्या है? So let's look at it. The first convention is for alphabetic index and tabular list. The ICD-10 is divided into alphabetic index, alphabetic list of terms and their corresponding codes, and the tabular list, a structured list of a code divided into chapter based on the body systems and conditions. Okay, this is the main difference. कि alphabetic index ने जो which is our first step to find the code, it is just a alphabetic list, just like हमने देखा ना A से B तक. So alphabetic index is just an alphabetic list. तो उसमें क्या होगा, any disease start from A से लेके Z तक सब वो अरेंज किए रहेंगे. आई विल शो यू. Okay, yes, here is it. You see guys, ये बुक में सब सिस्टम भी है और उसके डायग्राम्स भी है. So this is see index of disease injury. So it start from A, C, just like our telephone dictionary, just like our word dictionary. It starts from A. So any disease starts from A. First, we have to go and check in this alphabetic index. See here also. In this page, you will find A to AB, AA to AB. See, whatever the abnormalities are there, you will find here. Abnormal albumin, abnormal autosomes, okay, abnormal blood level, abnormal iron. अभी अभी डॉक्टर हमको बोलते हैं ना यार आपका क्या बोलते हैं उसको, ब्लड बहुत कम हो गया है, तो आयंस का हम यहाँ पे कोड दे सकते हैं. कोरोनरी एब्नॉर्मल कोरोनरी आर्टरी होगा. ओके, सो दिस इज हाउ इट इज. द अल्फाबेटिक्स कंटेन्स A to Z कोड. देखो अभी ये A है, ये AB है. ओके, ये AB सीरीज का है. इफ यू गो मूव अहेड देन ABC. देखो ये B. ओके, ब्लीडिंग कहाँ पे हो रहा है, ईयर में हो रहा है क्या, गैस्ट्रोइंटेस्टाइनल. ओके, इरेगुलर ब्लीडिंग नोज में हो रहा है क्या, कहाँ पे हो रहा है, इवोल्यूशन में हो रहा है, कहाँ पे हो रहा है. ओके, प्री प्यूबिकल वजाइनल ब्लीडिंग है क्या, कौन सा है, थ्रोट में ब्लीडिंग हो रहा है क्या. सो दिस इज बी, दैट्स व्हाई इट इज कॉल्ड एज एन अल्फाबेटिक इंडेक्स. फर्स्ट स्टेप हमारा यही है कि अगर ब्लीडिंग हो रहा है तो चेक करना है. अगर देखो कि यहाँ गैस्ट्रोइंटेस्टाइनल, तो यहाँ का कोड क्या है K92. ठीक है, तो ये K92 जो सीरीज है, तो मुझे वो टेबुलर इंडेक्स में जाके ढूंढना है कि K सीरीज कहाँ से स्टार्ट होता है, एंड देन विल फाइनलाइज that which code I have to code, because this is an alphabetical index also. Only this will not give you the whole description of a code. Take my point here. Alphabetic index will only guide you, but the final decision what you have to take, that is from the tabular list. That's our first step is to check with alphabetical index, and the alphabetical will lead you to tabular index. Now then go to tabular index and decide what exactly code we have to do, what code we have to give. Got my point? Yes, no, yes, no.
Yes, sir.
Okay, guys, this lecture should be interactive. Okay, so that's why it is saying that alphabetic index, an alphabetical list of a term and their corresponding codes. And what is the tabular list? It is the structure list of the code divided into chapter based on the body systems. Now, very simple example. We'll take this only. See, gastrointestinal bleeding. Gastro means it is dealing with GI, right? GI,
Yes.
right? Okay.
Yes.
So for GI, we have code 9K92.2. So the GI related system means it is GI related condition, but it is a gastro system. And the gastro, all series are start with K, and that K series will you find in the tabular list. Don't worry, we'll definitely take some big example with that. We'll go with all as much as possible. We can take some practices, but for understanding purpose, just keep in this mind what is the alphabetic index and what is the tabular index. Okay. Now I will show you the tabular index also. Don't worry. Once I will show you tabular index. So guys, this WhatsApp. Just give me 1 second. See how to search here. Here is K92.2. Sorry, this search is not helping. Okay, anyways. Oh, what this? We are only here on itself. What a guess, guys. See, this is a tabular list. Can you see here? Right side of tabular list. Correct? Can you see?
Yes, sir.
Yes.
Okay. So hope you understand what the difference is with alphabetic index and tabular index. In alphabetic index, we would not have to find all these things, but in tabular index, we are getting multiple options here. भाई ये गैस्ट्रिक एंड डियोडिनाइटिस, ये जो कोड सीरीज है, इसमें इतने सारे कंडीशंस है. एक्यूट गैस्ट्राइटिस भी आ सकता है, कोलिक गैस्ट्राइटिस भी आ सकता है, सुपरफिशियल गैस्ट्राइटिस भी आ सकता है. गैस्ट्राइटिस एकदम एक्स्ट्रा गैस्ट्राइटिस नहीं है, इसमें ऑल अदर गैस्ट्राइटिस, ये डियोडिनाइटिस भी आ सकता है. So that's why our thing is to on the particular code we need to check first alphabetic index and then the tabular index. Once you came across the tabular index, you will get a more option. Then you can find exactly which code you have to give for that particular medical record or that particular diagnosis. Got my point? Okay. So, I could able to explain you. Okay. So that's why it is. The tabular list are the structured list of code divided into chapter based on the body conditions, like a body system. I'll go back to this slide because see, disease of diagnostic system, it is a K series. Okay, so this is a tabular index. That's why it is saying that as per the body system, they are divided to get the perfect code, specific code. The alphabetic index is of in parts, index of disease and injury, the index of additional cause that we are also seeing, the table of neoplasm and the drugs and chemicals. Is anybody having doubt in this slide? We are seeing these conventions and general coding. Hope you know the difference of alphabetic index and table index. Can we move ahead? Yes, we can. Now, very important part is here is that format and structure. Now, what format and what structure? Is it I'm talking about the book's format or structure? No. Whatever the format and structure about the book, I have already discussed it. Now, the format of structure, it is now related with the codes. The ICD-10-CM tabular list contains categories, subcategories, and codes. Characters of categories, subcategories, and codes may be either a letter or a number. I don't know, you people might be thinking that यार बंदा तो सिर्फ read कर रहा है, ये कर रहा है, कुछ explain नहीं कर रहा है. नहीं भाई, मैं read वही से ही कर रहा हूँ क्योंकि ये सब coding guidelines है. हमको यही से ही learn करना पड़ता है. Okay, I can give you the slides also, no problem. But why I am preparing you in that way? Because you should keep insisting on this guideline. कि ये जो है वो already set है and that we only need to follow. That's why I'm using this guideline. I will just take a snip of it and then just dictating it. Okay. The all characters are three character. All categories are three characters. Okay. A three character categories that has no further subdivision is equal to a code. Then the subcategories are either 4 or 5 character, maybe 3, 4, 5, 6, 7 character. This is each level. So this format and structure is completely deal about how our ICD diagnosis code is structured. This only meaning is that the ICD code is divided into category, subcategory, and the code that we will see. And code may be 3, 4, 5, or 6 characters. That is each level of subdivisions after category. The final level of subdivision is a code. The code having applicable 7 characters are referred to as a codes, not subcategory. A code that has applicable 7 characters is considered inviting without 7 characters. So this is how they have set the guideline. Now come to the very simplified manner. Just leave that whatever you have heard before. Just focus on this. This is the code structure. 1, 2, 3, dot 2, 3, and this. So you see, and 6, 7 characters. So IC10-CM having a diagnosis code of how many characters? 7 character at the most. Okay, जो हमको diagnosis code देना है, it is in alphanumerical form, right? तो alphanumerical form में at least 7 characters तक वो code concised है. 7 character के आगे एक भी character disease और injury को reflect नहीं करता है. So anybody ask how many characters are there in ICD-10-CM? So your answer would be at least 7 character, maximum 7 character. Okay, this is the structure of a code.
एग्जाम्पल
And that too, बोलिए ना, एग्जाम्पल देता हूँ ना. बस आपको ये ध्यान में रखना है कि यहाँ पे हमने जो स्लाइड रीड की थी, द कोड में बी 3, 4, 5, 6 और 7 कैरेक्टर्स. दिस इज अ 3, 1, 2, 3, 4, 5, 6 और 7. यहाँ इसमें ही वो कोड होगा. इधर वो कोड 3 डिजिट का होगा, इधर वो कोड 4 डिजिट का होगा, 6 डिजिट का होगा, 5 डिजिट का होगा, नहीं तो 7 डिजिट का होगा. 8 डिजिट का कोड नहीं होगा. तो आईसी का कोड जो है वो एटलीस्ट 3 डिजिट होगा, 4 डिजिट होगा और 7 डिजिट होगा. and that's how it will be. हम देखते हैं यहाँ that आपने एग्जाम्पल बोला था ना, आपको एग्जाम्पल दिखाते हैं। ये देखा आपने, जस्ट टेक ए लुक ऑफ इट, K3183। अब ये कितने डिजिट का कोड हुआ?
4
कितना? 6
4
डिजिट, एब्सोल्युटली करेक्ट, बराबर एकदम। तो ये 6 डिजिट का कोड हुआ, K फर्स्ट, 3 सेकेंड, 1 थर्ड, 8 4 एंड 3 5। तो ये कितना डिजिट का कोड हुआ? ये 5 डिजिट का कोड हुआ, K3083। ओके, सो ऐसे कोड है कि जो सीरीज के भी होते हैं, 3 कैरेक्टर के भी होते हैं, 4 कैरेक्टर के भी होते हैं, 5 कैरेक्टर के भी होते हैं, 6 कैरेक्टर्स के भी होते हैं, 7 कैरेक्टर के भी होते हैं, पर 7 के आगे एक भी कैरेक्टर का आईसीडी का कोड नहीं होता। ओके, टेक दिस इन पॉइंट, टेक अ मेक अ पॉइंट। सो इसमें जो स्ट्रक्चर है वो कैसे अरेंज किया है वो अभी हम सीखेंगे। 3 सीरीज, 1 2 3, ये जो 3 कैरेक्टर्स है ये डेसिमल के राइट साइड में वी कॉल्डिंग एज अ मेन कोड। कोई इसको तो बॉस भी कहते हैं, ऑलवेज चेक द बॉस, क्योंकि ये जो है इट विल गिव अस अ कैटेगरी कि ये जो आईसीडी का जो कैटेगरी है उसमें हमको क्या ढूंढना है। दैट इज व्हाई इट इज अ मेन थिंग। जैसे हमने जो शिंदे देखा था ना, तो सेम थिंग इसमें भी वही है, इट इज अ मेन थिंग। देन 4 5 6 डेसिमल के बाद में जो व्हाट इट विल बी गिव यू, इट विल बी विद द etiology, it will give you the anatomical side, it will give you the severity of illness, it will give you the laterality. This is for 4 5 6 character, and 6 and 7 character will show you the more specific etiology, the more specific anatomical side, the more specific severity, and the more specific। यहाँ पे जो यहाँ पे भी जो थी एनाटोमी थी 4 5, पर यहाँ पे इंडिपेटियोलॉजी। अगर इंजुरी है, ठीक है, तो इंजुरी फ्रैक्चर है, तो फ्रैक्चर विल बी द माय फर्स्ट 3 कैरेक्टर। ओके, हैंड विल बी माय 4 5 कैरेक्टर। हैंड में भी कहाँ पे फ्रैक्चर है, रेडियस में है, अल्ना में है, दैट विल बी माय 6 एंड 7 कैरेक्टर। गेट माय पॉइंट? अंडरस्टूड? एग्जांपल फ्रैक्चर का,
Yes.
ओके, 3 कैरेक्टर, 4 5 कैरेक्टर, 5th कैरेक्टर, 6 कैरेक्टर, 7 कैरेक्टर। फर्स्ट 3 कैरेक्टर है, इट इज द मेन कैटेगरी, जस्ट लाइक एन एग्जांपल ऑफ एन इंजुरी। इंजुरी जो है वो हमको फर्स्ट 3 कैरेक्टर में होगा, पर इंजुरी कहाँ पे है, वेदर इट विल बी इन हैंड, वेदर इट विल बी इन लेग, that will be that etiology, that anatomical site will be described in 4 5 6 digit. 7 will give you the more appropriate location of a severity of the particular disease. Hope you have got this point, not just like a look of it. Here you can see K92, ठीक है, gastric adenositis, gastric and duodenositis. So K92 ये जो है it is my category. Okay, this is my what category, and after the decimal there is a K92। नीचे देखो K92.0, it is showing the acute gastritis. So this is giving me a more specific severity of illness. Got my point? That fourth letter, that is 0, it is showing, it is saying me that patient को gastritis भी है, but it is 0 and it is an acute. Next come to that K92.2, पेशेंट को गैस्ट्राइटिस डिजीज भी है और वो अल्कोहलिक है, that is the 4th character it is showing me. Got my point? So here the code will be 3 digit, but it is still not complete, because here you can see the red mark is there. Hope you can see, I'll just zoom in. दिखाई दे रहा है? I think the vision is very blurred, that copy is little bit blurred, but I can guide you that. See here, K92.4, K29 जो है gastric and urinitis, यहाँ पे red sign दिखा है, right? It is saying that fourth character is important. So this code, when it will complete, when you will add a fourth character, and once I add the fourth character, it is giving us a red circle, that is saying the fifth character is important, because the fifth character will give me the more specific severity, more specific laterality. Just now I said here, 4 will lead you to some sort of anatomical side and severity, but as the characters are increasing, they will give giving me the more specific codes, more specific severity, more specific in depth of the code. करेक्ट? यहाँ तक मैं K92.0 तक मैं acute gastritis तक पहुंचा, और acute gastritis में भी with bleeding है, without bleeding भी है. ओके, सो पेशेंट को अगर गैस्ट्राइटिस है तो मुझे देखना पड़ेगा यार उसको ब्लीडिंग हो रहा है कि नहीं हो रहा है. अगर ब्लीडिंग नहीं हो रहा है तो मैं K29.00 कोड दूंगा, और उसको विद ब्लीडिंग हो रहा है तो K29.01 में कोड दूंगा. दैट्स इट. ओके, hope you understand. No,
Yes, sir.
only one person is giving response. How many are there in this?
Sir.
12 are there. Okay, Harshad, are you getting? You there? No.
Yes.
Jitendra, Prithvi, Rekha, you getting
Yes,
my
sir.
point, guys? Hope you are
Yes.
not getting any doubts. You didn't ask me anything. Rekha, Arya, is it you all? Siley, you there, guys?
Yes, sir.
Any doubt, anything?
No.
No? I think, shall I ask you the question, then I will come to know whether people are getting or not. Can I ask you the questions? Guys, ये समझा आपको? जितना भी diagnosis code, it is of 7 characters. Okay, first 3 characters will be the categories, और 3 के बाद जितने भी characters आएंगे, it will going to give me a brief definition or brief severity, etiology and more specificity of the particular diagnosis. जैसे हमने अभी लोग का देखा था, कैरेक्टरिस्टिक्स में bleeding भी होता है, non bleeding भी होता है. Same like that. If you go with that again, I will give you some other fracture example also, but it is again very difficult to find the code in this. Here also, this is more important. K31, this is category, other disease of stomach and duodenum. This is category, but it is saying that fourth letter is important. So I go with the fourth letter, 1, 2, 3, 0. So it is the fourth letter is as acute dilation of stomach. This is a 0. It is giving you more specific information. And K31.1 is saying adult hypertrophic sclerosis of stenosis. Okay. So disorder of stomach or duodenum में भी dilation भी आता है, और other hypertrophic parotic stenosis भी आता है. Okay. So how these are giving us a severity depending on the system. अगर यहाँ पे अगर कोई इसका फ्रैक्चर होगा तो वो फ्रैक्चर का लोकेशन बताएगा और दूसरा थिंग बताएगा, पर यहाँ पे अभी डायजेस्टिव सिस्टम है तो डाइजेस्टिव सिस्टम में इतना ही हमको वो इंफॉर्मेशन दे सकता है. दैट्स व्हाई द डाइजेस्टिव सिस्टम एंड अदर रेस्पिरेटरी और अदर सिस्टम्स दे आर लिमिटेड विद द 4 digit codes. But if you think about the injuries, they will occupy the all the 7 locations, 7 categories that we'll see. Okay, guys. See how everything just like you said, we have to go with the all instructions side by side. Hope this slide is clear that category 3 codes, then subcategory, and then the final code that will give you the more specificity. We'll see the next slide and we'll wind up, guys. I think it's overloaded to you all. This how it is. See this slide carefully. 3 is a category, 4, 5, it is a subcategory, 6, 7, it is a code, that is the extension, etiology, and definition. The neighbor, now, why we have come across this? यहाँ पे दिख रहा है 6th and the red sign. That's why I'm saying you. This is the thing. This is red sign. Mean this is saying that you should not code only K41 as alone. We need to look for the 4th. Red sign is stop. And 4th, it is saying we need to have a 4th code. And once you find the 4th code, again it is saying that red sign, and in the red circle, it is 5th. It is saying that the K410 it's still incomplete. You have to search for the 5th code. That will lead to you a correct diagnosis. Then we have to go with that. Okay. K4101. So this is a complete code. This is complete code. For this femoral hernia, there will be only 2 types of diagnosis will be there. That will be bilateral femoral hernia with obstruction, without gangrene, not specified as recurrent, and the bilateral femoral hernia with obstruction without gangrene. And it is saying recurrent. See the difference. It is specified that recurrent and it is saying it is a recurrent. तो femoral hernia भी है, एक recurrent है और एक non recurrent है. तो physician हमको बोलेगा whether this hernia is recurrent. Then if it is a recurrent, then we have to give K0, K4101, and if it is not recurrent, then we have to give K4100. Just follow the instructions here. 5th character required, 4th character is required. Hence, it is the code set. Whether it will be the 3 characters, 4 characters, or 7 characters. What my point, guys?
Yes, sir.
Any doubts still here? You want me to give some more examples? Yes, no? Okay, we'll go with the 6th slide. Here you will come to know what I was trying to explain you from the last 15 minutes. Can anybody interpret the site from me, please? What they can see? Can you anybody tell me what is the category in this kit? What is a subcategory in this, and what is a code? A complete code. Just help me out, guys. I am just very much confused on this slide. Please help me. Anybody who's interested? Jitendra, Rekha, can you help me with this slide? Just tell me what is the category in this? No? Just speak up, guys. No responses. So I will go with the back again. The code structure. The code structure, it is of 3 character, 4 character, 5 character, and 6 character, correct? If you go on with this slide, I already said you, there is no specific that the code will be of 3, 4, 5. As much there are etiology specification, the digit will increase. Just we take an example of gastritis, duodenitis, there are only 4 digits of code. But in this case, as it is an injury, it is taking more lateralities, more etiologies, and more specificity. Hence, the digits are increasing. Series S67, X37. It is an injury of urinary tract and pelvis organ. So this is my category, right? But this is an injury of urine and pelvic organs. But urinary organs are many, or urinary organs are there. Urethra is there, kidney is also there, bladder is also there. But at where the injury has occurred, for that specificity, it is saying me that you need to code fourth digit. If I'm going to get the fourth digit, it is saying me that it is an injury of a kidney. Then again, it is showing me that you need to code a fifth character. Why fifth character? Because there are two kidneys, right? Whether the injury is for right kidney or left kidney, that how I can know. That's why I'm saying that, okay, fine, this is an injury of a kidney, but you need to go for the fifth digit, that is whether it is a right or left. Once I get the fifth digit, it is again showing me, fine, it is a right or left kidney, but for the location, we need to find the seventh digit, whether it is an initial encounter, subsequent, or subcula. No, not getting. The first three digit, I will ask. Yeah, someone saying something.
Not getting, sir, this point.
Okay. See, I will go with the best. We have 3 digit code, 4 digit, and 5 digit, and 6 digit. The 3 digit is common, that is a main code. And once you are going with the 4, 5, 6, it will give you more specificity. Just like take an example. Here, it is an injury of urinary and pelvic organ. Okay, but urinary organs are not one single organ, right? Urinary organs are kidneys are there, urinary bladder is also there. But where is the injury has occurred? The fourth digit will, here 3 digit will be give me the information of there is an injury of urinary and pelvic organ. But which organ, that will give me the fourth digit. The fourth digit, C, S37.0 has given me the thing that it is an injury of a kidney. Okay, so I came to know with the fourth digit that the injury of a kidney, but it is not still satisfactory. The kidneys are there two in the body, but which kidney, right kidney are affected or left kidney are affected? That's why it is saying that it is still incomplete code. To get the proper answer, you need to see for the fifth digit. The fifth digit will say you that there is an injury of a kidney, but it is of a right side or a left side. Okay. Hence, it is saying that the unspecified injury of a kidney. Got my point? And again,
I think it's 009.
which one? 009? Yeah, unspecified. When it is unspecified laterality. But if the patient is, which the physician is documenting, there is an injury of a right kidney, then we have to put S73.001. Okay. The sixth digit will give me the laterality. All right. And the seventh digit, see here in the pink box, the appropriate 7 character is to be added to each code from the category S72. And why it is the 7 code? That is the initial encounter, subsequent to the sequela. Now, why it is initial encounter? So, A is for initial encounter when the patient is having that injury, and that injury, with that injury, he is presented to the hospital. Hence, it is the initial encounter. Okay. Once he is being treated, and once he's being treated, the patient is being sent to home and say that come after 10 days. When with the same complaint, he's again visiting to the hospital, then it is becomes a D, that is a subsequent encounter. Got my point? And again, when this condition is being treated, but still he's having some sign and symptoms or some having problem with that, and if he's keep coming with that injury, then it will be the sequela. Got it? So take it my point. These 7 characters are totally depend for the injury purpose. Whenever there is an injury, you will find all the 7 characters here. But just help me with that. Have you understood that why 4 series is here, why 5 series is here, why 6 series is here, and why 7 series is here? You got my point? Or you want me to explain again? No? चलो जल्दी जल्दी बताओ, फिर से बताना है क्या? नहीं समझा? जल्दी बताओ, फिर से बताना है क्या?
नहीं सर।
अच्छा मुझे बताओ, 6 character what it is representing?
स्पेसिफिक जहाँ पे चोट लगा है या फिर नहीं लगा है जो
Exactly, it
हाँ
is giving us a laterality. Okay, इसको बोलते हैं laterality कि राइट में है या लेफ्ट में है. ओके, 5th कैरेक्टर क्या बोलता है?
फिफ्थ कैरेक्टर में हम ये देखेंगे कि ये पहली बार हुआ या दूसरी बार हुआ या फिर ये बार बार हो रहा है, सीक्वेंस में हो रहा है.
ये 5th कैरेक्टर में हम सिर्फ देखेंगे कि इंजुरी अनस्पेसिफाइड है, किडनी को हुआ है. और 7th कैरेक्टर में हम देखेंगे कि ये इनिशियल है या सब्सिक्वेंट है या सिक्वेल है. 7th कैरेक्टर, रिमेंबर दिस पॉइंट.
या
ऑलवेज
राइट.
हाँ, ऑलवेज 7th कैरेक्टर विल यू लीड टू दैट ओनली, whether it will be the initial encounter, subsequent or sequela. Okay, okay guys.
Yes.
Yes, sir.
So just as of now, just keep this thing in mind. I think it's at 12 o'clock. Thank you for your patience, and we didn't took a quick break actually in between. Sorry for that, because I don't know. I was in the flow. I just keep thinking from my mind that we need to go for the break. But fine. Till now, it is too much for you for the first lecture. You guys can go with this. If you have any doubt, you can, I don't know how you can call me or something like that. The institute will take care of that. But even hope you got my point, what I wanted to tell you in this session, as it was the first lecture of our class. And it was introductory also, that's why I'm not going in much, putting lots of slides in here. I just stop here. Hope you people have understood that. Still, I'm saying you, if you have any queries, any doubts, you can clarify with me right now. For this point, it is not that we will grasp in the first instance also. In next lecture, I will also give more examples on that, and and I will try to make you confident on this. Okay, it is always the first time, it is very difficult to grasp also, but once you got the things in mind, it is very helpful for you. So then after that you do not to trace that much, but it is a basic concept that you need to understand. So we'll stop here, I think, guys. Thank you for being patient for this lecture, and is hope anybody's from the institute here. Hello, is anybody from the institute?
Yes, yes, yes.
Yeah, ma'am, I will stop here. I must almost take 1.5 or more that. Hope the people
Okay,
are
fine.
getting my
Yes.
point. So we'll stop here today, and we'll see you in next class, guys. Till then, you
Okay.
just go with all the materials and come up with lots of questions. I'll be very happy to solve you. Even I will stay here for the more than 10 minutes. I will stay here for the 10 minutes. If anybody has any questions, related to this coding as well as future or anything you want to clarify, you can ask me. I'm open for that. I'll be here for 5 more minutes. Okay, great. Thank you.
Yeah, first of all, I would like to thanks our trainer Sagar sir for conducting wonderful session, and I hope everyone understood this. And now, just ask first the technical sessions, and then we have a information. We will share information related to the course curriculum. Okay. So before that, if you have technical question related to today's session or related to the medical coding, please ask everyone.
Yes. Okay, can you tell me something about yourself? आपने कैसे शुरू किया और अभी आप एज ए ट्रेनर वर्क कर रहे हैं, तो बता सकते हैं आपने कैसे शुरू किया था?
मैंने कैसे शुरू किया था, तो I was started this medical coding in late 2013 actually. Okay, 2013 में मैं स्टार्ट किया था. I was just like you people. I've been I'm graduated with BTech Biotechnology background. Then I went for the MBA. I did marketing also. Then in marketing I worked with MQR as a territory manager. Then I promoted to regional manager. But everything, you know how the marketing things are, यहाँ जाना वहाँ जाना, तो थोड़ा सूट नहीं हुआ मेरे को. So to be very honest, then I was starting to see something like, क्योंकि मेरे फ्रेंड्स भी थे, सो आईटी में काम करते थे, वो मस्त एकदम. तो मेरा था तो उसका कि यार मेडिकल कोडिंग काइंड ऑफ थिंग ऐसा है. तो देन आई केम टू नो अबाउट दिस. Then that time I started with my career with Gibbs International. That's there in Mumbai. So the Gibbs was having the policy that they hired peoples and then they get them certified. So I went there. I spent 1 year in Mumbai. Then I get CPC certified. Then I Pune. Then I work with the national. They work with the Pune itself in nice access healthcare. It's almost been for me 10 years in this field, and it is much growing field as well, and not just for the career as well. The industry is fundamentally is also growing, economically is also growing, and as per the aspect it is also growing, because I started my career as an medical coder, a junior medical coder. Then I grew as a senior. Then I become an auditor. Now I'm working as a trainer as well as a team lead in the company. So don't worry about that. In the introductory session, I also said that that I quoted one example. I don't know whether you were there in the introductory session. That in just take an example of coronavirus, then every industry was down, but only the healthcare sector was growing. When everybody was laying off and they were not working, they're staying home at home. But we people were used to do OT, and we were such a tired of doing OTs and all, because it's healthcare sector and mostly the medical coding. As it is, though it is became depending on to the US healthcare, but still we can survive more 15 years in this easily. Hope you got my answer. So it is a very good field actually. It is not that it will keep you updated again every time, every year it will keep you updated. Hope you got my answer.
Yeah, thank you.
Anything else? Anybody?
You can ask also question in chat box. Otherwise, you can unmute and ask, please.
No
Yes,
questions.
sir. Start the presentation.
Sorry, can you repeat? I didn't heard you properly. His voice was breaking.
Yes, I will take first small presentation regarding our academy information, and after
Sure.
that we'll have the question and answer session. Okay, so please be there.
Okay, fine. Sure. I'll hear him.
So any other question is there to everyone? Sir, just give me a minute. I will start. Yes, my screen is visible. Yes, my screen is visible to everyone. Please confirm.
Yes, ma'am.
Okay, fine. So, as you all know that this free demo class on CPC medical coding, which is organized by the Global Pharma Academy Pune. And so, moving to the next slide. So, Global Pharma Academy Pune, we are the Global Pharma Academy, which is the ISO and MSME certified national level institute in pharmaceutical and healthcare sciences, established with a proclaimed objective of becoming a center of excellence to guide students for building their career in pharma sector. So we offer certification programs like CPC medical coding, and here I welcome the founder of Global Pharma Academy, Amit Kumar Mani. Education, he completed M Pharmacy and MBA. He is the master trainer for the clinical research, regulatory affairs, and pharmacovigilance in LSSDC. And he is the owner of Malan Medical and distributor Pune since 2013. And he is the trainer for retail and wholesale pharmacy business management. He is the host of one YouTube channel also, and channel name is Things by Amit. Also, we have a family of 1 lakh plus subscribers on our YouTube channel. So to know the all update regarding our courses, career guidance, interview preparation, you can subscribe our channel. Name is Things by Amit. Here I welcome the HR of Global Pharma Academy. Her name is Shubhangi. She completed the Bachelor's of Pharmacy and she is the HR of our organization, having responsibility of job assistance, provide knowledge regarding interviews and skill development. Her email ID is globalpharmaacademy@gmail.com and her contact number is 7499252772. So to know the all update regarding the placement assistance or placement information, you can connect with her through this mail ID or through this contact. So this is me, Business Development Executive of Global Pharma Academy. Myself, Snehal. I completed my Bachelor's of Pharmacy, and here I resolve the general queries of Global Pharma Academy students, assist them for the daily assignment, mock interview, and project work. So this is my contact number 9322341947, and this is my email ID globalpharmas516@gmail.com. So to know the all update regarding the courses information, you can connect with me through this number or through my mail ID. Here I welcome the admin of Global Pharma Academy. Her name is Akanksha Pawar. She completed the BSc and she is the admin of our organization, having responsibility of institute connection, periodically post student feedback, connect with institute students and content writing. Her email ID is globalpharmas67@gmail.com and this is her contact number 7558527115. So if you have any, if you want to arrange this session in the college or guest session like, so you can connect with her. Moving to the next slide. Mission and vision. So with the goal of educating every aspirant who want to work in the pharmaceutical sector, we offer education at most affordable price in India. Our goal is to lead the pharmaceutical training market on a global scale, and India should grow into a country known for innovation and quality. We want to be the first global platform where business executives may select the top personnel in the pharmaceutical sector to satisfy the most recent industry demands. Benefits. Our students are trained and nourished under excellent faculties having 15 plus years of industrial experience as well as academic excellence. Here, students are rigorously trained to meet the industry requirement. Why us? Apart from domain knowledge, we provide this assignment and task, resume preparation, communication skill, presentation skill, mini project, conduct mock interviews, personal development, provide job assistance, conduct examination, and doubt clearing session. So syllabus of CPC medical coding. So this is the syllabus that will cover during our 3-month online certification course. The business of medicine, review of anatomy, overview of ICD-10-CM, applying the ICD-10-CM guideline, accurate ICD-10-CM coding, introduction to CPT, HCPCS level 2 and modifiers, then integumentary system, musculoskeletal system, respiratory system, cardiovascular system, then hemic and lymphatic system, mediastinum and diaphragm. After that, digestive system, urinary system and male genital system, then female reproductive system and maternity care and delivery, then endocrine system and nervous system, special senses, ocular and auditory. After that, anesthesia, radiology, then pathology and laboratory, evaluation and management services, then medicine. So that's study material provided for the CPC coding course. So we'll provide hard copy of CPC book and question paper. There's soft copy material, CPT book, ICD-10-CM code book, and HCPCS code. So after your enrollment, we'll provide material through hard copy also and soft copy. So if you want to visit our offline office, you can visit here. So this is the offline office address. Global Pharma Academy, flat number 1, Lakeview Apartment, Modern Colony, in front of Ambassador Hotel, FC Road, Pune. So we visited to the institute also to conduct the guest session, like on various career opportunities in pharma. So here are some pictures. So this is the achievement. We awarded as a top 10 promising clinical research institute in 2024 by Silicon India, which is India leading technology and business media company. We awarded as a top 100 inspiring entrepreneurs of India by the Entrepreneurs of India. Moving to the next slide. So this is the certificate of Global Pharma Academy. Once you're done with your course, we provide this type of certification. So how to enroll for the course? Pay online, Google Pay, Phone Pay to 9423272876. After successful of payment, share payment screenshot with your name, email, location, qualification, WhatsApp number on WhatsApp to 9423272876. After that, you will get the seat confirmation email, and before one day, all class group on WhatsApp where all class link and recordings share.